Hi, I'm Dr. Thom Bober. I'm a practicing chiropractor on Cape Cod, Massachusetts. I'm here today to discuss a little bit about MaxPulse testing and how we can use this as a tool to improve your function and your well-being. It's important to understand that the MaxPulse is simply an indicator to show us how it is that we can improve your function through diet and lifestyle. At no time are we trying to diagnose a disease or to give you a cure for a disease. We simply want to help you on your road to better health. The basis of everything we're going to discuss today is pulse wave and pulse wave analysis. So what do I mean by that? Let's look at the board. When your heart beats, blood is pumped from the ventricle out of the aorta. That first contraction of the ventricle is the pulse wave that we can feel on our wrist or on our neck. So we're going to draw that here. As the blood moves down the aorta, it hits a spot where it divides to go into the legs. At this point, a secondary pulse wave is created. As we move through life, depending on the rate at which we are aging, the stiffening of the vessels will be displayed in the waveforms by their coming closer together. The stiffer the vessel, the closer together these two waveforms will occur. So this forms the basis of every other aspect of the technology that we're going to discuss. We are analyzing pulse waveforms, and from the mathematics behind this, we can determine some information about you and help you develop a better lifestyle to improve cardiovascular function. Now, the test that we're going to apply to you will produce a report, and on that report there are several different factors. The first thing that we can see from the report is a picture of your accelerated waveform. So this waveform, through calculus, can be converted into a different waveform that makes it easier for us to analyze different components of cardiovascular function. The first thing that you'll notice is called DPI. The DPI, or differential pulse index, is our best overall indicator of cardiovascular function. And on our report, you're going to want to see that bar as close to the right side under optimal as possible. The second component that we'll be looking at, EC, stands for eccentric contraction. And this is an indicator of how strong the contraction of the ventricle was. That is, the part of the heart that actually is pushing the blood into the aorta. We're determining how strong that was. So we want that, again, we want that bar to be way over to the right side as far as possible. The next component, AE, stands for arterial elasticity. Naturally, we want our arteries to be as elastic as possible. So again, we want that bar to be as far over to the right as possible. The last component on this section is RBV, which stands for remained blood volume. When the ventricle contracts, we hope that as much blood as possible is removed from the ventricle and moved into the aorta, where it moves into circulation. Again, this is something that shows up as a negative number, and we want that to be as negative as possible, which shows up on our chart, again, as being as far right of the column as is possible. You'll next notice a wave type. In this particular picture, it was type 2. What this means is, of the 7 categories of wave types, the vast majority were type 2. Now, in a perfect world, in a newborn baby, we would have 100% of the waveforms in type 1. And no matter what our chronological age, we want our biological age to be as young as possible. So our assessment goal is for you to be able to improve your cardiovascular function so that 100% of your waveforms are in type 1. The different waveforms from 1 to 7 are an indicator of lowered function. Again, important to remember that we can't make any diagnoses from these tests. It's simply a level of function that we want to improve. And based on the recommendations that we have given to hundreds if not thousands of patients in our own clinic, we know that we can improve that level of function. So that's this right section of the test that you're performing today. You also have a left section, and this is an entirely different way of looking at cardiovascular function. What we're looking at here is called heart rate variability, HRV. Our heart rate, based on the stresses of our life, will go a little bit up, and hopefully when the stress is gone, a little bit down. And the ability of our heart rate to move up and down in response to the stresses of life is a strong indicator of our well-being. When we lose the ability to adapt to stress, either by increasing heart rate in the presence of stress or decreasing our heart rate in a time of rest and relaxation, we're losing the potential to handle the stresses of our life, again, which is going to be a marker of biological age. Not that this is an indicator of disease, but we're trying to improve function, and this is a marker for function. You'll notice on the left side of the page, there's an indicator of the balance between the SNS and PNS. That is, the sympathetic nervous system, which is kind of like a gas pedal, and the parasympathetic nervous system, which is more like a brake pedal. We're trying to find a nice balance between the two. You can also see on the graph 3 sections that indicate physical stress, mental stress, and stress resistance. Naturally, we would like our physical and mental stress to be as far to the left as possible under the low side. As far as stress resistance, we want our stress resistance to be as far to the right side, indicating that we have a large bank account to handle the stresses of our day. The last section gives you a number from 0 to 100, indicating the kind of stresses and how able our body at the present time is in handling those stresses. The last section of the paper just gives us an overall written assessment or summary of what it is that we've seen on the graph. I hope this has been an informative piece of information to help you better understand the testing that you've had or the testing that you're going to be having over the next few minutes. Again, I do want to caution you that at no time are we trying to diagnose or cure disease. We're simply looking at your cardiovascular function with the intention of giving you the strategies, both in diet and lifestyle, to move that function forward to whatever potential you're able to obtain. Thank you very much. I appreciate your time. I hope you enjoyed the test. I hope you ask questions, and I hope you learn something that's going to help you on your pathway to better health. Thanks.